Hello, everyone. My name is Vinod Kumar Chauhan, and I will present the paper Adversarial De-confounding in Individualized Treatment Effect Estimation. This work is done in collaboration with Soheila, Molaei, Marzia, Hoque, Tania, Anshul, Thakur, Tingting, and Professor David Clifton at the Kai Lab Institute of Biomedical Engineering, University of Oxford. David is also associated with the Oscar Research Center in China. So this is the outline of my presentation, starting with the background. Randomized controlled trial experiments are the gold standard to evaluate the effectiveness of treatments, although they are very expensive, time-consuming, and they have smaller and less representative samples. Non-experimental observational studies can be used for evaluating the effectiveness of treatments, and they can address the limitations of the RCT. Observational studies have recently received significant attention from the machine learning community, although use of machine learning for treatment effect estimation from the observational data is a different and a more complex problems because the observational data lack counterfactual outcomes and have selection bias. Suppose if we give some treatment to a patient, then we observe the outcomes which are known as factual outcomes. But what would have happened had we not given the treatment? Those outcomes are called counterfactual outcomes, and in real life, we either give treatment to the patient or not. So the counterfactual outcomes are always missing in the observational data. Similarly, when we give treatment to the patient, we look at their history. This results into selection bias because there is a covariate shift between the control arm and the treatment arm. In this paper, we will talk about the individualized treatment effect estimation problem, which is also known as a conditional average treatment effect estimation or heterogeneous treatment effect estimation problem. This is a fundamental problem in causal inference literature and is very helpful for making personalized decisions. So ITE estimation from the observational data is a challenging problem, and it involves a fundamental problem of deconfounding, that is a removing of selection bias. So this is the problem setting we have assumed. We assume binary treatment setting where context affects the treatment and as well as the outcomes, and treatment affects the outcomes. Now we assume that this context has 5 types of variables. Variables which affect only the treatments are called instrument variables. Variables which affect the treatment as well as outcomes are called confounders, and the variables which affect only the outcomes are called as adjustment variables. They further can be divided into three categories: variables which affect only the control outcome, and one which affect only the treatment outcome, or the ones who affect both outcomes. So our work is based on standard assumptions of causal inference. These are stable unit treatment value, ignorability, and overlap contributions. So this paper proposes novel disentangled representations with the adversarial training to selectively balance the confounders in the binary treatment setting. So unlike the existing literature, which balances the entire context, we first learn the confounder representations and balance only the confounders, which results in better results. So we use disentanglement representation learning to separate the confounders, and this is based on a specific deep learning architecture as well as orthogonality constraints. And the adversarial training jointly optimizes the confounder representations to minimize the loss for the potential outcome predictions and maximize the loss for the treatment assignments. And we have done experiments on the synthetic and and semi-synthetic data sets, as we will show in the coming slides. So this is the proposed architecture, which we call as SNet Plus, which is an extension of SNet. So in this architecture, here we have context. This is passed through 5 different MLPs, which try to learn representations for 5 different kinds of variables in the context. Although these MLPs are not sufficient to get those latent representations, so we use orthogonality. And in the orthogonality, first we first we calculate the contribution of each variable in X on these representations, say for confounder representations. Once we get those contributions, we take dot product of all possible combinations of these representations, and then we add that to the loss function as a regularizer, and this helps to learn these disentangled representations for different variables in X, and this ensures that each variable in X participates only in one of these latent representations. So for the orthogonality, here for calculating the contributions of each variable on these representations, we multiply all the layers inside that MLP and take average along the rows, so that we get one value for each variable in X. And then we take dot product for all combination of these representations and add as a regularizer. Although this may result into a situation where this contribution vector is a 0, so to avoid that situation, we add this an extra regularizer. And then these representations are used, the adjustment factors and the confounder factors are used for potential outcome functions, which along with the factual outcome is used for calculating the loss. And here confounder representations and instrument variable representations are used in the treatment classifier, which along with the treatment assignment give us loss for the treatment classifier. Now here for the adversarial training, we put this gradient reversal layer between the confounder representations and the treatment classifier. During the forward pass, this layer acts as an identity, but during the backward pass, it reverses the direction of the gradients, and also multiply this with the parameter lambda to control the effect of the gradient reversal. And when we jointly optimize the loss function, this results into representations for these factors and the confounders, such that it minimizes the loss function for the potential outcomes, but maximizes the loss for treatment classifier. This results into confounder representations which are agnostic to the treatment, and thus it helps to balance selectively balance only the confounders, not the entire representations for the entire context. So we used this formula for controlling the gradient reversal parameter. And next is results. So these are our baselines. We have extended SNet to SNet Plus and DRCRF, DragonNet and DragonNet TR with the adversarial training, although only SNet and DRCRF has disentangled learning with adversarial training. And for performance metric, we have used PEHE, which is precision in estimation of heterogeneous effects. And the code for our experiments is available on this Code Ocean repository. With the synthetic results with the synthetic experiments. So here PEHE refers to performance on the training dataset, and pay out refers to performance on the held out dataset, and values in the parentheses refers to one standard error. So as we can see from these results, T-learner is the best performer and SNet Plus is the best performer. Moreover, we can see that these plus extensions of the baselines are able to improve their corresponding baselines. Here we study the effect of the scale and number of confounding features on the performance of the estimators. In this left figure, we have performance on the y-axis and dataset size on the x-axis. So in general, we see that as the dataset size increases, the performance improves for all the estimators. And we observe that SNet Plus consistently performs better than the corresponding baselines. And similarly, we observe that here, as the number of confounding features are increasing, the SNet Plus outperforms all the baselines, as well as the extensions of the baselines show improvements over their corresponding baselines. Here we present the results with the semi-synthetic benchmark IHDP, which is Infant Health Development Program. This is a semi-synthetic data set in the sense that the features of the data set comes from the patients, although the outcomes are simulated, because in real world life, in real world, we can't have counterfactual outcomes. So once again, here we observe that here S-learner is the best performer, but Tarnut is the best performer. Although the adversarially trained extensions of the baseline show improvements over the corresponding baselines. In conclusions, so in this paper, we propose disentangled representations with adversarial training to selectively balance the confounders, unlike the existing literature, which balances the whole context. And one limitation of this work is it introduces a new parameter, this lambda, to control the gradient reversal effect, which has to be tuned for each data set. In the end, I want to acknowledge my funders and thank you very much for your time and attention. If you have any feedback or comments, then please let me know.